Good morning, everyone. I am Dr. Ashwin. I welcome you all to the second day of the IAPSM Young Leaders National Conclave 2021. Today, we'll start our session uh, with an interesting talk, an interaction with Dr. J.P. Muliyil. So I request Dr. B.S. Garg, sir, who is the Director Professor of the Sushila Nair School of Public Health, incorporating the Department of Community Medicine here at MGIMS Sevagram, who is also the Director of the Collaborative Center, WHO Collaborative Center for Community-Based Maternal, Newborn and Child Health. He's also been the Honorable President of IAPSM in the past. So I request him to please chair this session and take this ahead. Over to you, sir.
Okay, thank you, Dr. Ashwini. So I extend you a warm welcome on behalf of Kasturba Society and on behalf of Mahatma Gandhi Institute of Medical Sciences to this session on Meet the Public Health Leader. And there cannot be a better person than Professor Jayaprakash Muliyil. Let me introduce Professor Jayaprakash Muliyil. Dr. Jayaprakash Muliyil completed his undergraduate studies in medicine and postgraduate studies in community medicine from Christian Medical College, Vellore, and joined the faculty of community health there. CMC has a community health and development department which is known as hospital rather chart program with a secondary care hospital as the base hospital covering a population of 100,000. Dr. Muliyil was specifically in charge of leprosy control program. In 1985, he went to Johns Hopkins University at Baltimore, from where he completed MPH and DRPH in epidemiology. On return, he became professor of community medicine in 1990. The first formal course of epidemiology in India was started at CMC Vellore in 1992. From 2002, he served a 5-year term as the principal of prestigious Christian Medical College, Vellore. He is closely working with the government of India on various health projects and scientific advisory committee or strategic committee on several national international institutions. As you can see here, the medical consultant to Leprosy Mission International, visiting professor of Trust University Boston and Copenhagen University, Denmark, ICMR Scientific Review Committee, and he is specifically the chairman of ICMR, the Scientific Advisory Committee on the National Institute of Epidemiology. His area of interest is infectious disease, leprosy, and child survival blindness control. Professor Muliyil has published over 160 papers in international and national journals. I have some interaction with Professor Muliyil, and I found him a simple, down-to-earth, and informal person. So I'm sure that you all will enjoy, you all will learn from the Professor Muliyil experience. So over to Professor Muliyil.
Thank you, sir. It's my privilege to address this gathering. However, what makes me nervous is my perception about my competence to be talking to you. I'm described as a public health leader, which I never realized I was or never intended to be. So the other issue that bothers me is that I'm used to speaking on issues about epidemiology, leprosy, infectious disease, but I've never spoken about myself, and that puts me in an awkward position. However, I recognize that there are a lot of young people getting into this field of public health and weaving their way through, often finding difficult situation and needing to make decision as to a way forward. I guess some of the difficulties I faced would be of benefit to them. So these are my learning experiences that I'm going to share with you. And some are positive, some are negative, but on the whole, I pray that this will be useful to you in making your own life's choices. Now, I joined CMC Vellore in 1969, and that was a time when things were not very prosperous. CMC was a well-known college, but it was on meager resources. And that frugality was imprinted in all the students and staff, the way we behaved. But during my internship, I remember meeting a husband, wife, and a 2-year-old son in the casualty. I remember the husband walked in rather stiff into my examination room, and he obviously had tetanus. So we admitted this guy, and remember, CMC is a private institution, but we do a lot of charity. And when we admitted him, again, this husband, wife, and the 2-year-old walked into the ward. Immediately, the nurses said, oh, no, children not allowed here. So there are some neighbors who had brought them here. They sent the son away, and these two were in the ward. Now, as you all know, tetanus has a very high case fatality rate, 30%. So we struggled with the patient, and I was the treating intern. And I spent a lot of time struggling with this guy's spasms and a whole lot of problems. And then I saw this lady sitting under his bed and crying, weeping. So I went and held a hand and said, listen, this is one of the best hospitals in the country. We'll do our best to save your husband. So she looked at me and said, I am not crying because of him. You know, when I came into this ward, that 2-year-old boy, my son, was with me. And you said we can't keep him in the ward. So we sent him back to the neighbors, and nobody was really looking after him. He was playing around and he fell into a well and died. And the next day, this husband also died. Now, he has a disease which is so easily preventable. But also look at the way a little social dislocation can affect the safety of children, pregnant mothers, and elderly people. So we are rather tenuous in India in terms of how people survive. Things have to be, if you dislocate the system, children die, pregnant mothers suffer. And I think that is a lesson that is deeply imprinted in me. I remember that time reading George Bernard Shaw's book. It's called The Doctor's Dilemma. And in that book, I'm sure some of you have read it, he describes a town where the judge and the hangman both were the same guy. Further, the guy was paid not according to the judgments he passed, but according to the hangings he did. Now, what do you think those who were brought to him as prisoners faced? The judge is paid by the hanging, and I suppose there is a conflict of interest. And so George Bernard Shaw was trying to point out, if somebody is brought to a doctor with an ingrowing toenail and he removes the nail, he will probably get 100 rupees. But he does a below knee amputation, he will get 5,000 rupees. Now, he was trying to be a sarcastic, whimsical, but the point is our health system is proceeding in that line. And this kind of upset me quite a lot when I finished my internship. I had another problem too. I had to borrow money from Christian Medical College, the law, to pay the fees. So I had to work for the institution for 2 years to make up for it. But I had a choice which department I worked in. And I chose to work in a department of community health because I was getting uncomfortable with this, first class security care. Something was not gelling with my personality. But luckily, the Department of Community Health, at that time, it was headed by Dr. V. Benjamin, a good clinician. His assistants were Dr. Abraham Joseph, a pediatrician, and Dr. Surojana, an obstetrician. And so this place had an adequate amount of clinical work, but also had outreach services leading on to villages. So this was a good setup because we were not just taking care of people coming ill, but we are trying to manipulate the community in terms of primary health care, primary prevention, and health promotion. So this particular story about community health and development has been said in many fora, and that grew very rapidly into a large organization. And I had the opportunity to work there. And I suppose this particular environment kind of nurtured people in a manner that made them sincere health workers. And I want to explain this whole concept of nurturing atmosphere or environment. There is I forget his name suddenly. Anyway, it'll come to me. He was a nephrologist. He was an orthopedic surgeon who came to India, and he got very impressed to see all the leprosy patients. And because patients were never to come to the hospital, they would always stay outside. And they would say, why don't they come into the hospital? They said, no, when they come, other patients will leave the hospital. They have leprosy. Anyway, he worked a lot for the leprosy patient, and he's probably the first one to discover patients don't develop ulcers because the lepra bacilli eats leprosy patient's flesh. It's because of anesthesia that they develop these kind of ulcers. Now, he went on to develop a series of surgery and tendon transplants, which helped many patients with leprosy-related deformity. But one of his actions, which annoyed quite a lot of staff of CMC, this is back in 1950s, he decided to start a center for rehabilitating leprosy patients inside the college campus where staff and the families live. And this annoyance was expressed to him. He said, listen, we are living with our children and families. How can you make leprosy patients live with us? His simple answer was, don't worry, I will build a long wall around the place. You will be pretty safe. Anyway, his name was Paul Brand, suddenly struck me. Paul Brand built this leprosy rehabilitation center right in the middle of the college campus of Christian Medical College below. Now, over a time period, the walls started breaking down. Students would run or jump across the wall and sing songs with the people in the who lived there. And they used to grow chicken and eggs there, and they will bring into the campus to sell it. And the leprosy became a less stigmatizing disease over a period of time. So many generations of students who passed through CMC never was scared of leprosy, or they never shunned leprosy patient, and they were willing to work in different leprosy hospitals. Now, during the nurturing time, we are faced with many options. And in preparing medical students, we need to remember the atmosphere they grow in must be something that is conducive, creating professionals which are generous and who have the willingness to serve. So that was the environment in which I worked in. Luckily, when I joined the Department of Community Health, I was happy with my clinical work, I was happy with outreach work, but I needed to do something special. And I chose to do leprosy because there was nobody looking after. And I had the privilege of taking care of many of Dr. Paul Brand's old patients, who used to tell me how Paul Brand did it, unlike the way I do it. Anyway, this particular exposure to leprosy was a very interesting thing. Here is a marginalized group, the subtle, the marginalization. And the stigma is in every way. And it was a way, this prejudicial atmosphere put them in an awkward position. I felt very strongly against this behavior. The only thing we could do as an institution was to treat them fairly. Elements of public health basically involve a sense of justice. If there's no justice, there's no scope for public health. And you and I, are part of the system which fight for justice of all. And that can be quite difficult because we live in a world of a strange way of success being defined. Success is defined as how much money you make, how much material possessions you make. Even when you calculate the socioeconomic scale, we take into consideration material possession. And you are better off than somebody who doesn't have as much you have. We live in a world where the economics is based or is a zero-sum game. When I say zero-sum, I mean there are winners and losers. You can't have a economic game based on all being winners. Now, public health should be an exception. Over a period of time, medical industry has grown very powerfully. It has become expensive and many people can't reach for it. Public health is the only solution in terms of justifying what is right for people and how do we maximize our resources so that many can benefit. During this period, I remember I went to Hopkins for a training in epidemiology. I had a wonderful time, but initially it was very difficult. I left behind my wife and 2 children. The son was 4 years old and daughter 1 year. It was not easy for me. And in a few weeks, I started developing clinical signs of depression. I couldn't eat, I could sleep, I couldn't focus on anything, and I realized I was in trouble. Remember, I went from my Department of Community Health, the Chard Hospital, where I was busy doing a lot of work, and suddenly in Baltimore, I was nobody. I was one among the 500 students, and nobody cared whether I existed or not. I used to go to class, come back and sit. It was quite a different experience. And I knew that the reason I was depressed was that suddenly a purposelessness came over me. So I decided I am going to go back to India. Forget MPH, forget DRPH. As I got up, I looked across the room and there was a Bangladeshi guy who was sitting there looking more miserable than me. So I walked up to him and said, "Hi, what's happening?" So he said, "I don't know. I can't sleep. I can't eat. I can't figure out what is going on around me. And I can't understand anything these teachers are talking about." American accent to a Bangladeshi could be quite hard. So I, on an impulse, said, "Supposing I were to help you with your homework." Remember, I had a little better exposure to the subject back in Bello. So I sort of volunteered. And he found it very useful. He was a regular trainee under me. And in a little while, Pakistani, Bangladeshi, Sri Lankan, several joined the gang. I had a bunch of 30 students being tutored by me. And when the term ended, all of them passed the tests they were intended to pass. But more importantly, my depression left me. In life, it happens when you are useful to others, you will find that your mental health, a quality of life, all are better. When you are focusing on your own well-being, your own progress, suddenly things go wrong. So if at all when you get into trouble, and if you think you have a sense of no purpose in this world, ask the question, whom can I help? And when you start helping people, their life looks more beautiful. Experience in Hopkins was very, very exciting. The amount I learned, the amount of opportunities we have to learn is great. At the same time, there was a downside also. Hopkins was surrounded by big walls and securities. Now, back home, we didn't have any walls. We reached out to people. Hopkins was surrounded by black community, and they were poor, and they often attacked the student, mugged them, molested them. So they kept on increasing cameras, and then they kept on increasing security. It didn't work. And I realized community health outreach program was a much better way of dealing with injustice than having walls around you. Actively engaging people, being friends with them, supportive of them, and helping people. We have a larger mission than what we think our principles of public health reads. It is in transforming community. Fortunately, in community health department, there's a lot of emphasis on health, community development, income generation, community organization, and CMC's outreach programs was quite large, including a large tribal area. So I'm grateful to the environment that we grew through and which helped the development of this, system. One of the most interesting things I got involved with was training people in epidemiology. I loved doing that, and I never got tired of it. And the most important thing I learned was that most of your learning comes from your student. Fresh from Hopkins, had a doctorate, I thought I knew everything. But each time I met a group of students, they would challenge you with some interesting question, which I didn't know the answer. One of the early days I remember somebody standing up and asking me. I was teaching the well-known example of sensitivity and specificity. So your 2 by 2 table, A, B, C, D. This guy asked me, so when you do a diagnostic test, you get positives and negatives. Yeah. So when you go for a survey, you get test positive and test negative. I said, yes. But I don't want to know how many test positives and how many test negatives there are. I want to know how many people have the disease, how many don't have the disease. You see? And in that particular period of time, nobody had taught me. You get A plus B as test positives and C plus D as test negative. But what we want to know is A plus C, total diseased, and B plus D, not diseased. How do you get that? How do you calculate the true prevalence of the disease from test positives? Now, I remember answering him, listen, I don't know the answer, but tomorrow my morning, I'll figure it out and let you know. Those of you who now know Bayesian analysis, the thing, it's really easy to recalculate. But it so happened, nobody had taught me. So I had to figure it out myself. And next day I came and then asked. Repeatedly, these kind of things keep happening. So on the whole, I don't know who taught whom more, me, my students, or my student, me. So the exciting thing about training, teaching people, is that your own knowledge horizon goes up, and that each of you will experience. I had this privilege of having wonderful students throughout. In fact, most of my students have reached greater heights than I am able to do. They are really brilliant, they done well, and I'm proud of them. So the principle I always work with, if I know 100, if my student knows 90, and this student knows 80, we'll all go back to dark ages. So theoretically, a student should become better than his teacher. That should be the natural way of evolving in education. So I always respected my student. If you doubt me, you ask my student. I've never been cross with them. I don't recall being shouting at anybody ever. But because I had this inborn respect for all my students. But I think that is important for your health and students' health. I've seen very often, when you become a professor, big teacher, the feeling of self-importance creeps in you. And that's why, and I was nervous about the word, meet the leader kind of thing. Because in CMC Vellore at least, we practice the principle of servant leadership. We need leaders, but not leaders who will be glorifying themselves, but leaders who will facilitate others, push others up so that they will be able to reach greater heights. And that is the kind of teaching group that we need. That's what IAPSM should encourage and inculcate in everyone. Because remember, unlike other divisions of medicine, departments of medicine, we have to work with people, not on people. We have to work with people. And because success is when others do better than before, and we were able to catalyze the change. And when you know this principle, you will realize that life is so much more rewarding. I want to tell you about two miracles that happened in my life. One was in 1986. I was stuck in Baltimore. I've been there already 1 year. I was missing my family, and there I was, feeling depressed and remote. Somehow I want to get back to India, but I had no money. So I was going again, showing signs of depression again. One day I went to the cafeteria and I looked around. There was no empty chairs except one with a professor of preventive medicine. Now, he is not a very person who I thought was friendly. I never had interacted with him. He looked a little grouchy always. And as this
Today, Dr. Nandran is going.
and anyway, reluctantly, I took my tray and went and sat next to him. And he grunted at me, I grunted back. And we started slowly talking to each other. Soon the subject went into polio. And I talked about a peculiar finding and experience. Always children who came with polio were chubby children. It led on to discussions on various hypotheses. And at that time he said, can you do me a favor? Can you write up this in a little kind of a short description? Let me see if we can get somebody to fund this idea. So I wrote a pre-proposal for 2 pages and left it in his office. A week later, he called me and said, I was there with the USAID. They were quite excited about it. They're willing to fund it, but on one condition. They want me to go all the way to Vellore and do a site visit to see the feasibility of doing the study. And then he asked me this question. There is enough money. Will you be able to come with me and be my escort? Because I don't know anybody in Vellore. It was God-given opportunity. USAID is paying for my travel, and including a bata, mind you. And I was overjoyed. And I called it a miracle. Okay, it happened. I was dying to go back to home, and I got a free vacation. I can go and come back and then continue my course. A little later, I was in my hospital. This is a second miracle. I walked into this. I had gone for a field trip, came back late. It was past 9 p.m. I was sweating, I was dirty. And as I got out of the van, at that time, our hospital had just gone on an expansion. A new labor room was built. Unfortunately, the staffing was not perfect. There was not enough staff to run a bigger hospital. So we were going through a crisis. At that night, I heard a cry from the labor room where I got off from the nearby. So I said, oh, somebody will look after. And the next moment, I said, no, let me go and check. I walked into the labor room. There was a woman in labor about to deliver, okay? And nearby was an old grandmother standing there, quite bent and frightened. So I quickly washed up and went to her. Apparently, this grandmother has been going and calling the nurse. Nurse kept on coming and looking after and looking at her, and then said, no, little more time, little more time. And then suddenly the baby started coming out. So anyway, I conducted the delivery, pulled the baby out, finished, got the placenta out, and I washed up, went up to her and held her hand and told her, the mother, listen, you did very well. So she grabbed my hand and held it close to her chest and said, Doctor, do you remember 3 years ago when my son was born? You are the one who looked after me. Today I was alone, I was frightened, nobody around. And then I prayed to God, please send Dr. JP to me. And there you walked in. You were sent by God. Now, for her, that was a miracle. She will never forget, because when she prayed, she got something. Now you look at the two miracles. In one, I was rewarded, and the other, I became an instrument in somebody else's miracle. And I thought the second one was a more satisfying event. And I think all of us get lots of opportunity to make a difference in other people's life. The community, colleagues, students, patients. And I think in that way we are blessed. And I hope you remember this, that you are already sitting on a gold mine with a whole lot of opportunity. Very often I find students and staff disgruntled, not happy. And I think it is because you're not focusing on the right questions. We cannot keep on asking, what do I get? What do I have in me? How do I get success? No. If you reverse that question, say, where can I contribute? What can I give? And then I think you will be more useful to the society. At the same time, your own quality of life improve. I think we should pursue happiness, and pursuit of happiness are right. But the method of pursuing happiness is through creating happiness in others. Remember, somebody did a research on how come one cannot tickle oneself. Tickle, and you tickle a baby comes out in peals of laughter. But you try tickling yourself, you don't feel like laughing. And some neurologists actually studied it, the concept of tickling. And they said what apparently happens is when the baby sees a hand coming towards his belly, there is an anxiety building up in the brain. And actually the hand is gentle and touching. The brain says, relax, no danger. And the relief comes out in peals of laughter. But what you require is a sense of kind of a surprise. That's why we can't surprise ourselves by tickling ourselves. But the point I'm saying is, we are born as a species which is capable of making others laugh, but can't make ourselves laugh, actually. So happiness is something you can give. And that in our profession, when you deal with people, it's such an important lesson to remember. Now, this journey has been a long one, and I have privilege of knowing lots and lots of people. Lots of people have contributed in my journey, and I don't know how much I've been able to give back in return. But thing is that in the whole process, how many people I dislike? Hardly any. And I think that is the greatest achievement in my mind. I remember in CMC, I became a principal, agreed. Then I told you, it is not kind of a coveted position, it's a responsibility. And here it is a system is that most people, everybody is allowed to vote. There's no actual voting. You can write and say, I recommend this fellow to be a principal or whatever it is. And this papers are gathered and given to a committee to review it. And they use a judgment of various factors and choose. And I was told an overwhelming majority wants you to be the principal. I became. It is a big responsibility, troublesome. But again, I told you, as a servant leader, Your worry is not how well you're doing. Your worry how well everybody else is doing. And as long as that is fine, and you are okay. Now, only one strength I had when this particular option came, whether to do it or not, it was because I had not developed hatred for even single person, which was kind of encouraging. Why do I say this? I've seen people wasting energy and time being in a negative mode, fighting with people. It's a waste of your precious life. And especially for in a profession like ours, where we don't achieve anything in isolation. We achieve through our teams. And team building is a secret of public health intervention. And there's no role for this, quarrels and animosity. And I think if you embark on your journey in remembering this, I am sure your lives will be much more fulfilling than mine have been. Thank you very much. That's all.
Thanks a lot, Professor Muliyil. Dear friends, I think you have heard just Professor Muliyil, and I again reiterate that the true quality of Professor Muliyil is simple, down to earth. He has a passion, the practice of public health and epidemiology. He has a mission in his life to help people, to do something for the community, to work with the people. I have one or two experience which I'll share later on, but before that, you must have a few questions to Professor Muliyil. So it's open to the crowd, to the organizer to pose the questions to Professor Muliyil, and which I think he will answer in case, say, you have decided one by one, but better is this, you say, send the questions and then Professor Muliyil will say answer. Yeah. Dr. Ashwini, whether you have already some questions or how you will open it?
So we'll open to the audience.
Okay, so it's open to the audience. Anybody can raise hand and then say he will be given opportunity to speak. Yeah. It's another quality of all of us. We wait. Who will be the first? Anyone? Yeah, Dr. Subodh.
Yeah, Professor Muliyil, it was wonderful listening to you. It was so inspiring. I would like to ask you your opinion on or your advice for a future team builder and a leader. What would be your advice, sir? You have already talked about it, but still I'm repeating this.
Yeah, there's an old saying, don't judge a person by the way he faces adversities in life. Judge him by the way he handles power. And the moment you put a person as a leader, something goes wrong with the individual. And the way he walks changes, and the way his mannerism changes. That good guy suddenly become an obnoxious guy. And it happens again and again. And it's a sickness that we have to fight again deliberately. And I've seen many people who have done it confidently. I tell you, team building is empowering people. And if you want to control everybody, then you got it all wrong. Okay? And many systems fail because of this conflict in idea. Empowerment is team building. Discipline is not a good way of creating a team. Discipline must be coming from within the heart of each individual. Self-disciplined people. Select them. But then once you select them into your team, I think you should be in an empowering mode. Now, anything that you think of constructing, a medical college, a department, a team, there are two ways of doing it. And one is to design it. You put a paper, you design everything, but there is another way things happen. It is called emergence. See, when you put carbon, hydrogen, and oxygen, sweetness emerges. Now, none of these three elements have sweetness, but the sweetness, the quality emerges when you're put them together. Emergence is a phenomenon that should be nurtured in every great institution. Okay? In other words, you put in something to the creation of the institution, but the reward you make is much greater than what you put in. Emergence does not work with a restrictive environment. It comes through a nurturing environment.
Thank you so much. So beautifully you have answered, sir.
Yeah. Any other question to Professor Muliyil? Dr. Laria, Dr. Chandrakant Laria want to speak. After that,
Yes. Hello.
yeah, Doctor.
Yes, Chandrakant, I can hear you.
Yes, Professor Muliyil, thank you very much. And it's always pleasure to hear you. So, I have learned a few things from you, and I thought this is the right opportunity to ask that question. So the question is a little philosophical, but I think you are the right person to answer that. We know that in India, the respect is often equated that we should not question the person whom we respect. So if somebody who is really senior and respectful, if he has some opinion, we should we are expected not to question that person. But when it comes to public health thrives on debating and questioning the conventional wisdom. In addition, we know that Aristotle and Plato was student and teacher relationship, and that time the much of the dialogue and much of the debate happened because the teachers and student questions each other. So my question is to you, sir, that how we can bring the culture of questioning the seniors and still respecting them to promote public health in the country. What are your thoughts? Thank you very much.
You know, Charles Darwin, when he had the idea that there was this whole concept of evolution, he was 21 or 22 years old. Okay. Isaac Newton, the whole concept of that principia involved, he didn't write it up immediately, but all came to him very early in life. 26 he was when he understood the whole thing. Einstein, both special theory of relativity and general theory of relativity, came up very early in life. But there is a group of people who believe that young minds have a great potential if only you let them be free. In India, we stifle them systematically. And this is because as teachers, very often we feel insecure and that we lose out. But you see these guys who travel across to United States and then they do postdoc work. They shine there. Why? because they professors know the trick. Get his mind to work and solve the problem. Of course, the Nobel Prize will go to the old man, but still, the youngsters do contribute. I think we should twist it around, Chandrakant. We should turn it around and say this system has to be based on young minds and a little bit of impetuousness. That will give you the right way to challenge things. I support that.
Thank you, Pastor Muliyil. So there are two more persons. I think Dr. Kanyan Venu first, and then Dr. Kadri, please.
Hello, sir. I'm Dr. Binu from Kerala. Sir, I've sat in your class at CMC Vellore. I've seen the model of CMC Vellore. You involve in teaching, you involve in research, you are part of policy making. Sir, my question is, we have ample potential leaders of IAPSM in all medical colleges, especially the private, but there are few opportunities and platform for these persons. So what would you advise, sir? What IAPSM should take a lead to involve and give platform for them to involve in all these research activities? Usually government gives opportunity only for government colleges. And I feel this private community health professionals are not utilized mainly.
Yes, I think you're absolutely right. And but you know, one of the studies I did was following up 15,000 leprosy patients released from treatment, following up for 15 years, and it cost me 1,500 rupees. Okay. Now, many of the things that you want to do doesn't cost too much money. Okay? And simple initiative, and very often it gives great demand. So I think what I would suggest that is, don't wait for anybody to invite you. Don't create your own opportunity. Okay, and you can. The point is that everywhere that there is a need for intervention. What is the essence of injustice? Lack of equity in resource allocation. Does it happen in your neighborhood? It does. And you don't need an army to correct it. You need a few friends to change things. Many things have started as small little seeds and plants and grown up. And I wish you success. Kanyan, isn't it? And in your end, what is your name? Binu.
Kanyan, sir. Binu.
And I think you will get opportunities to do it, provided you grab these little things. And ask question is, don't worry about I'm not getting opportunity. Ask, how do I help anybody around you? You start with that, you'll find that life changes for you.
Thank you, Professor Muliyil. So now, Professor Amiruddin Kadri. Professor Amiruddin Kadri is Secretary General of Indian Association of Preventive Social Medicine. Yeah.
Good morning, sir. I think it was really an inspirational journey you have narrated in a very simple and sensitive way. Really, we have cherished each and every word you have narrated. I think, in fact, I take an opportunity to again highlight or reiterate the 4 points that you have highlighted. I believe saying that it is the wisdom of the negates based on your experience, and that everyone who are the young buddies are there from community medicine should definitely keep this thing in mind. What you have highlighted is that leadership is not just glorifying thing. Leaders is about the making other leaders. It is a responsibility and making other leaders. Definitely, we should remember this mantra in life. When we become the leader, we should not become like a boss or having the glorification. That definitely. One second thing that you have said is really very important thing. Work with the people and not on the people. I think many times still when we become the doctor and learned people, we start on working on the people. That is also a really important thing. And third last thing is the leader is not about how well I will do, I'm doing, but how well others are doing. I think building the team building, the most important for the becoming the successful leader is the really mantra. And the last thing is that our motive of the life should be there, that we should make the difference in the life of the other people. That is the important part of the public health. Thank you very much, sir, for giving this four mantra. My question is, sir, regarding is that you are very much passionate about the epidemiology and teaching the epidemiology. What we currently are seeing that in epidemiology, largely teaching of the epidemiology has become a bookish types of the teaching. How we can in the community medicine department make it more skill-based epidemiological learning so that really people, the PGs in the community medicine become really very well conversant with the epidemiological principles and theories.
Yeah, I think it's a very important point, and I think this has been discussed in the past too. I, we had set up this field practice area in England, real data coming up. These are the issues that, and I know when your research is based on problems that people face, then we'll be using real epidemiology. When your monitoring program, which is on people collected very genuinely, you will be doing with real epidemiology. But the problem with that is these numbers don't mean much to most unless they are connected with people. Okay, so I fully agree with you. To many, these are principles which has no bearing on real life, and that is not a good idea. I think our youngsters should become confident in looking at information and making life's decisions based on that information confidently. I think the only way to do it is to train them with real information and not artificially created stories.
Thank you, Professor Muliyil. Now the time is essence, so we have to stop somewhere. But 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 before we stop, say I would like to just share with you 2 or 3 short incidences. See, I was at Ben Gurion University, Bet Siva in Israel as a visiting professor. I took few classes. In the end, I had interaction with the faculty and student. They said, Doctor, there have been so many teachers from India, but we had Professor Jayaprakash Muliyil. He was unique. I asked them, what was uniqueness? So they said that was really interesting and I think practical also. They say we met so many epidemiologists, but whatever Professor Muliyil shared and taught us based on the practice. So a very, very clear message. Rather than teach the theory, you share your experience. Be a practitioner. Another time I was in Copenhagen with Professor Abraham. We were attending the World Federation of Medical Education conference. Again, CMC Vellore and Copenhagen University has a bilateral agreement where the teachers from CMC visit to Copenhagen. So with Abraham gave me the opportunity to interact few of them. Again, they said, yes, there have been so many, but Professor Jayaprakash was unique. Again, same thing, the practical thing, they say. So he is a real practitioner. Third small incident I had, I was in Sevagram. One gentleman, this Dr. Madhukar Pai, came to see me. He said, I am from CMC Vellore. I think Professor Muliyil was principal at that time. So I advise him, so tomorrow you are going to CMC Vellore. You must see Professor Muliyil and have some advice from him. He says, sir, not only I am meeting him, he has invited me on lunch also tomorrow. So such a simple man, down to earth, and working with the people, again important. Say CMC Vellore and Mahatma Gandhi Institute Medical Sciences have one commonality. We work on behalf of, say, on the basis of Gandhian philosophy but again working for the people, working for the poorest poor, and that gives the satisfaction in case we can do something. And similarly, CMC Vellore also represent another say approach, but working for the marginalized, working for the poor, working for the downtrodden, working for the sufferer. And in case you have pain, you have sensitivity for that, then certainly whatever you will do, so it will be a satisfying experience. I'm sure that you all will have learning with the experience sharing of Professor Muliyil, and the talk in a simple manner which Professor Muliyil has given to you will inspire you in one way or other. And tomorrow, I hope that you all will be the leaders in public health like Professor Muliyil. So again, on behalf of organizing committee, on behalf of myself, I express profound thanks to Professor Muliyil to be kind enough to join with us, to spare his valuable time and share his experiences. Thank you very much, sir.
Thank you.
So now over to organizer, please.
Yes. Thank you, JP sir. Thank you, Gag sir. Thank you, Kadri sir. I think it was a humbling experience for all of us to listen to the wisdom of JP sir. And we'll end this particular session. And I'll just remind everybody here, all the delegates here, to join for the Young Leaders Oration, which will start in a couple of minutes on the other link. Thank you, all of you.
Thanks a lot, everybody.